Hi and welcome back to the channel. Today I'll be talking about two amazing sets of master tongue points that can be used to treat the liver. Before we start and before I dive into the points from master tongue, it's important to define what we're talking about when we talk about the liver. And in Chinese medicine, when we talk about the liver, we're not always talking about the organ itself. We're talking about a set of symptoms that relate to the liver meridian and to the Chinese concept of the liver that doesn't always align with what we know the anatomic liver does. To begin with, we can divide most of the liver dysfunctions according to Chinese medicine in two major categories. We have excess problems, which are the most common ones that we see when we're treating liver problems in Chinese medicine, and are probably the ones that jumped into your mind as soon as I talked about liver problems. But we also have problems related to liver deficiency. And the two sets of points that I'm going to be talking about today, you're going to see one set of points that's amazing to treat excess related problems, and one set of points that's amazing to treat deficiency related problems. So stick until the end of the video so you can see the full list of points that I'm going to be talking about. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balance method to treat pain. This is a technique where you get instant relief in most pain cases, so if you want to learn about it, check them out. When we talk about excess related problems in the liver, we have three most common problems that we see. We have liver yang rising, we have liver fire, and we have liver qi stagnation. Of the three, I'm going to leave out the liver yang rising because here we're talking about an excess from the liver, but usually it's related to a yin deficiency somewhere else, so this doesn't come into the purpose of the video. But for the first two, I'm going to start with liver qi stagnation. We know that the liver is responsible to guarantee the free flow of qi, and when we have liver qi stagnation, the qi just can't circulate. Most of these patients will come with wiry pulses, emotional constraint. A lot of times they'll have pain. The problems will almost always be related to emotional stress. We're going to see almost always wiry pulses and trembling tongues. And as major symptoms, we'll see problems in the chest and breast area. We'll see oppression of the chest, irritability and frustration. We'll see a lot of insomnia. We'll see tension headaches, some menstrual symptoms, PMS for instance, and in a lot of cases we'll see anxiety disorders. So this is a kind of patient that we see a lot in our clinics. The other excess related problem that we see in the liver in most patients is liver fire. Here we'll see a lot of the signs that we saw in the previous case, but aligned with signs of heat. So we'll see tongues that are very red, a lot of times with yellow coating when it's starting to bother the stomach and the spleen. We'll see also symptoms in the upper jaw, such as headaches, bitter taste, red eyes. In a lot of these patients, they'll complain of dry mouths, constipation. They will also have problems with sleep, either difficulty falling asleep or waking up a few times during the night. A lot of times you'll see complaints of very vivid dreams where the patient can wake up very tired. You will see restless leg syndromes. You'll see a lot of cases of migraines, and you will also see a lot of skin and digestive problems that are related to stress and emotional issues, where the liver is going to impair the job of the earth or of the metal. And these are the two most common presentations for excess related problems with the liver. And for all these cases, Master Tung has a set of amazing points, and this is the point 1117 or Mu. As you can see here, this point is on your first finger in the hand, on your pointer finger. It has the shunjing of the liver, and as general indications it will work for excess of the liver, symptoms in the head such as dizziness, tinnitus, bitterness in the mouth. It can work for tearing eyes, it can work for excess related skin problems, it can work for restless leg syndromes. And if you think about the location of the point, well, this is the shunjing of the liver, but it's also in the area of the lung meridian in the hand. So Mu is an amazing point to treat skin problems that are related to an excess of wood that's invading the area of the lungs. So if you have a patient with, it can be eczema, for instance, it can be acne that's triggered by stress, a lot of times you will see that Mu will be very helpful for these patients. Also, this is one of the most amazing points for headaches related to liver problems, because the point treats the liver and it's in the hand, which is a fantastic image for the head. Usually we will use the 2 points together, and in most cases it doesn't matter if you're using them on the left or on the right, unless they're part of a global balance treatment. Since in most cases the symptoms you're treating won't have a side, so if you're treating anxiety or dizziness, it doesn't have a side, so it doesn't matter which side you're placing the points on. But if you're treating something which has a side, like a headache that's always on the right side, for instance, or tinnitus that's always on the right, then I would use this point on the opposite side. And now let's look into the deficiency-related problems. And when we think about deficiency-related problems in the liver, we'll have two major causes. The first of which is liver blood deficiency, and the second one is liver yin deficiency. Both of these conditions are usually seen in older people, but this is not a strict rule. They can be seen in younger people, especially if they work a lot, if they don't eat well, and it can also come from a very long progression of the excess related issues. So you can have a patient that has liver fire for a long time, he doesn't address it, and it ends up developing into liver yin deficiency, for instance. So it's very important, and sometimes it's hard to differentiate between excess and deficiency, especially because when you think of liver, usually we're thinking about excess related problems because it's the most common cause. But if you don't fully analyze your patient, sometimes you're making the wrong diagnosis and then you won't get results. So let's analyze first liver blood deficiency. Here in most patients you will see a pale tongue that can also be trembling. You can see usually a thin and a deeper pulse that sometimes can still be wiry, and you'll have symptoms that are related to the symptoms we saw for the excess problems, but with some differences. So we can still have headaches, you can have blurred vision. A lot of times in these patients you will see cramps. Cramps is usually a key sign of liver blood deficiency. You'll have patients with insomnia, very light sleep, and here almost all of them will have very vivid dreams. Talking about menstruations, you'll have scanty menstruations, or even patients that don't menstruate every month. A lot of times you'll have anxiety along with tiredness, sometimes even depression, and chronic fatigue. This is also very common in patients that recently lost a lot of blood. So this can be a post-surgery problem, this can be a patient who has chronic anemia, this can be a postpartum. So it's something that you need to keep an eye on because you need to address it in a different way from the previous problems that we saw. And the other most common issue that we see when we talk about deficiency in the liver is liver yin deficiency. Here, a lot of times you'll see heat, but empty heat signs. A lot of the symptoms will come at night. Sometimes you'll have thin pulse, but that's very rapid. Can also be wiry. Almost always we will have a very red tongue, usually without coating. As for symptoms, we'll see dry eyes, restlessness, anxiety. We can see insomnia. Again, we can see vivid dreaming. You'll have irritability. When we think about liver yin deficiency, usually you can think about a premenopausal state. That's a very classic presentation of liver yin deficiency. And for this kind of problems, we have an amazing Dauma, which are the three yellows. As you can see here, the three yellows, or 88 dots, 12, 13, and 14, are located in the thigh, in the middle of the inner thigh, so the area of the liver meridian. These points have the shunjing of the liver, heart, and kidney, which make these points amazing to treat deficiency associated with the liver, because you have the liver shunjing, but you also have what you can think of as the Shaoyin shunjing. So heart and kidney, they will treat blood and they will treat the yin. So this is an amazing set of points, and it's a mandatory set of points for any patient suffering from liver yin or liver blood deficiency. As a general rule, with these points, you'll be able to treat everything related to liver deficiency. So you'll be able to treat dry eyes, you'll be able to treat problems related to internal wind. So these points can be applied for a stroke, for instance. They can be used for insomnia, restlessness, irritability. These points also have a very interesting indication, which is they will treat every problem related to the actual liver. So if you have any patient that suffers from hepatitis, anything related to the anatomical liver, you can also use the three yellows. And these are the two sets of Master Tung points that, in my opinion, are the best to treat the liver. We will use Mu or 1117 to treat excess related problems related to the liver, and we will use the three yellows to treat deficiency related problems with the liver. This doesn't mean that you can't use Mu for deficiency related problems. In some situations it will make sense, or the three yellows for excess related problems. I'm just telling you their main indications and the main ways that I think about these points when I'm using them. And this is not a treatment protocol. As I always say, I'm only giving you tools to work with, and I hope that you can use them. Thank you so much for watching. If you liked the video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it, and I'll see you in the next one.